How to use caution in such spaces as grain bins, grain wagons, manure pits, tractor seats, and livestock flight zones. Accidents can and do happen. All it takes is a split second for those who work around these spaces every day. This year's theme for the week-long event is called Get Out of My Space. The U.S. Ag Centers have prepared a collection of safety resources for each day of the week, and each day will also cover a specific safety topic. For more information, log on to the web and type in Ag Safety Awareness Week. I'm Kathy Isom, Southeast AgNet.
Ocala's information station, 1370 WOCA. Ocala!
All right, 10 minutes before 11 o'clock. Thank you for tuning in. Silver Springs is now a state park, but before it was a state park, it was a tourist attraction, and they had a snake exhibit in there. Do you remember that?
I do.
Ross Allen was the famous snake and reptile handler, remember?
Yes, he's fabulous.
So I remember sitting in one of those wooden benches, and he had an audience around him, and he says, how many people here think he had a rattlesnake. Mm-hmm. How many people here think a rattlesnake is poisonous? And everybody raised their hands. And he said, you're all wrong. It's venomous. It was a semantics question, but the point, I never forgot the point because it's a funny question. Poisonous, he explained, means if you eat it, you die. Venomous means if it bites you, you die. Dr. Charles Gerardo is on the phone. He's the chief of the Division of Emergency Medicine at Duke University School of Medicine. And Lori Stone is the mother of a 2-year-old girl who was bitten by a rattlesnake. And so we're talking, and we live in an area where there are rattlesnakes. So what everyone should know about venomous snake bites, if you're walking through the state park, there are snakes there. Don't think that just because it's a state park that they got rid of the snakes somehow.
Yeah, no, they're there.
Dr. Gerardo and Lori, good morning to both of you.
Good morning.
Where are you? Where are you calling from?
Durham, North Carolina.
Oh, you got snakes there too. Are there snakes pretty much everywhere in the world?
In the U.S., they're in every state in the continental U.S. except for Maine.
Oh, wow.
Oh.
Lori, how is your daughter? Let me ask that first. How is she?
She's getting back to her happy, healthy self.
How long ago was she bit?
So this happened July 20th, this past summer.
Wow.
Okay, what happened? Did she step on it?
We're not quite sure, but she was just playing in the backyard with her cousins when she began to cry, and there was some blood dripping down her leg. She immediately became lethargic. Her eyes glazed over. We called 911.
Oh, my God.
Put her in the car, met an ambulance. She was unresponsive by the time we did meet the ambulance. And she was, at that time, my brother went out to check the backyard and realized that there was a 4.5-foot rattlesnake.
Oh, my God.
So they treated her, they intubated her and gave her her first dose of the antivenom Crofab. She had 2 wet bites, so then they airlifted her to another hospital where she did remain in ICU for approximately a week. She continued treatment there. She had multiple surgeries to save her leg. She had blood transfusions. She had 20 doses of the antivenom Crofab, and still coming home. It took her several weeks to begin playing and to walk again. This happened months ago, and she's still working hard at physical therapy, but I am happy to say that she is running around with her sister, despite having, she does have a little bit of permanent damage, but she's back to her happy, healthy self, and we are just thrilled. Without treatment, she wouldn't be here today, so we are so thankful.
Yeah, absolutely. I'm so glad that's the story. Doctor, does Lori's little girl now have an immunity?
No, actually, she could be bitten again, and she could still have a severe reaction. Although in this case, I'm pretty confident she'll never get bitten again.
So, is there anything that Lori has learned, or that we could learn from that, or from you now? So, if that same thing happened to us, we would do the same thing. We'd call 911. But in the meantime, is there something that could have been done?
No, actually, I would say that Lori did everything right, and none of the things that are harmful. So it could not have gone much better than it did in her daughter's case. So if you're bitten, the best thing to do is to stay calm and immediately dial 911, because the definitive care, the antivenom crofab, can only be administered in the hospital. So all of the things we've learned over the years to do in the field are actually not effective. So tourniquets, cutting the wound, sucking the venom out, all of those things do not help, and some of them even harm. So the best thing you can do is get immediately to the emergency department so you can receive the antivenom crofab.
How important is it to know what kind of a snake bit you?
Actually, if you have symptoms, so bleeding, swelling, pain, any of those types of symptoms, you know it's a venomous snake, so you don't need to know anything further than that, because the antivenom crofab works for all of the North American pit vipers, like the rattlesnake, cottonmouth, and copperhead, or pygmy rattlesnake that people in your area could come into contact with.
Oh, wow. Yeah, there was a lady who we had in our news, it's been a couple decades ago, but she died stepping into, I guess, some baby rattlesnakes. They were all, I guess even a baby has poison in it, huh?
Oh, yeah, absolutely. And if she was bitten by multiple baby snakes, then she may have gotten a significant envenomation.
Well, we do a lot of camping here in the state of Florida. There are a lot of campers. How do you prepare a campsite before you set up your tent and everything to make sure there aren't any snakes in that immediate area?
Well, I think one is you need to wear proper clothing. So if you haven't cleared the area, full-length pants, high boots, gloves if you're handling stuff to clear the area. And the other thing is where you're setting up camp, make sure it's not in the middle of the high grass if you can prevent it, and so it's been properly cleared of any animals.
Do you see a lot of snake bites?
Yeah, we see a lot of snake bites. I'm located in North Carolina, and we are one of the states that sees the highest number of snake bites per year in the U.S.
And Lori, now that your daughter is getting back to normal and everything, I mean, when it's the summer months, we love to wear sandals and shorts. Are you going to allow your daughter to wear that kind of clothing, or make sure they're long pants all the time?
Well, I think that we're going to have some snake boots for her. But no, we obviously couldn't do that to her. But we look down everywhere we go. We look down.
Yeah, oh my gosh, I would look at everything. What about a dog? Would a dog know? I mean, you don't want your dog to die, and I'm sorry, dog lovers, but I'd rather the dog get bit than the child. But does that sometimes serve as a deterrent if you have a dog, or I don't know if a cat would do anything?
Well, as far as dog goes, dogs absolutely are bitten, and they absolutely show symptoms. I'm not a veterinarian, so I don't want to speak, outside my area of expertise too much. But I do know that when they're bitten, they're usually bitten on the face, so they can have significant bites as well. They can't tell you how much pain and how much problems they're having, but they still can be significant bites.
But I guess my question is more about the dog chasing away the snake. Are snakes afraid of other animals?
Well, I think if it's a non-prey animal, so something that they're not trying to eat, absolutely. Having a large mammal like a dog around is probably a deterrent.
And is every emergency department equipped, knowing that when a person comes in, they know what to do about the snake bite?
Yeah, and also the patient can be armed with information. So there's an app that you can download for free, which is Snakebite 911, which is pretty informative. And also you can call the local poison center. But in your area, the hospitals in the area absolutely know what the treatment is, and they're stocked with at least the initial dose of the antivenom crofab, and if they require more medicine, then they can be transferred to a larger facility that has more of the antivenom available.
All right, so I think you hit on the real thing we want to leave the listeners with, which is how to get more information. So Snakebite 911, that's the app, right? Mm-hmm. And
yes.
Is there a website that you would recommend?
There's also crofab.com, which will tell you a lot about the treatment itself, and that can be helpful.
CROFAB?
Yes.
Okay, crofab.com. Okay, what does that stand for, crofab?
That's the crow is the beginning part of the snake family name, and the fab is the type of antibody that the antivenom is made from.
Okay. Lori, I'm glad your daughter is okay, and I don't know what you do to prevent snakes from coming in your yard. Oh my gosh, it's play Led Zeppelin. I think they don't like Led Zeppelin.
we cleared out anything that could attract snakes, like wood piles. So we kind of cleared bushes.
Wow.
We have a very plain backyard now.
Thank you both for being on the air with us. This is WOCA Ocala.
Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
Fox News Radio, I'm Pat O'Neill. President Trump within an hour due to issue a new immigration travel ban. As to what's different from the ban put on hold